Pledge of Allegiance, please. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Good evening, everyone. Nice warm February day here. We'll start the meeting by reviewing last month's minutes. I hope everyone got a copy of that via email. The only changes that I had on it were some spelling issues, but I think I corrected those before I sent them in the email, so the packet may have a different, I'm not sure if the packet does. Nope, the packet was corrected as well. So if we, anybody have any other changes on the last month's minutes? Then we will bring that to a vote as well. All in favor of approving the minutes to be published, say aye.
Aye.
And we didn't do the second thing, but any nays? All right, they're approved. Okay. Mr. Tautone, can we move on to the health officer's report, please?
Good afternoon to the board members, to our interns. In addition to our inspections for the month of January, I wanted to bring your attention to the quality of life issues. In one of the past meetings, one of the board members asked that I would put the resolution to the complaints. So that's what I tried to do in this report. We had a dog bite that bit a human. The dog that did the biting was current with his rabies vaccine at the time of the incident. We also had a complaint of a dinner party where there was 4 patrons who fell ill. When we investigated, we brought out 3 epidemiologists, 2 from the Reading office of the Pennsylvania Department of Health and 1 out of the Chester office. And once we investigated the complaint thoroughly, it was determined that the actual location was actually not in Radnor, but it was in Lower Merion. They weren't very clear on their description of the location. So it was actually in Lower Merion, not us. We had a complaint of radon gas in the rental house. The property owner did a corrective action to abate the radon gas. We had a complaint of a dispute regarding cleanliness of a homeowner of a rental house. The homeowner association and the occupant resolved the issue. We had an issue where there was no heat in an apartment. The heat was restored. We had a bat in the house that when a resident woke up and found it in the house from a sleep, the bat tested negative. There are several health advisories from the Pennsylvania Health Alert Networks that are in your packet. One was advisory number 323. World Health Organization declares Guyana is Ebola-free and cessation of Ebola screening. Health Advisory 324, malaria diagnosis, recognizing, managing, and reporting Zika virus infections. Health Advisory 327, partner services for STD, HIV patients, the responsibility of physicians in the Department of Health. Health Advisory 228, flu season begins, severe influenza, illness reported, and we had a notice from Delaware County Intercommunity Health, Dr. George Avedian, regarding an update on the Zika virus. Wanted to bring your attention to, in the back of your packet, the week of March 22nd to the 25th of 2016, free dental care for children and teens. Residents can call 215-563-5848, extension 32, to make appointments. And also, before I let you go, is Radnor Township employees participated in Pennsylvania Teen Health Week. There was a photo in the back of your packet. We thought that was a great idea, so we participated in that week, in that effort. So here's my report.
Thank you, Mr. Tautone. Appreciate it. We're going to expand on a few of the topics that Mr. Tautone had spoken about, specifically the Zika virus in new business, and as well flu and interesting updates on the flu virus this time of year. I'd like to just move on to old business as well and mention a couple of things. One, just to interestingly, the 10 quality of life issues that are listed in the health officer's report this week just goes to show you how much Larry has to do for this township, how many things there are to do in addition to the food place inspections. And in speaking with Larry this week and with via email, Mr. Zankowski, the Radnor Township did place an ad in newspaper general circulation and on the Radnor Township website to request an employment opportunity for the position of assistant health officer, and the township has received resumes for the position, and the interview process is either beginning this week or has begun. I think that'll be very helpful to continue our improvement and assurance for the township that we are securing their health by inspections of restaurants and dining facilities. Second, we have had discussions in the past concerning presentations to the Radnor Board of Health, small 5-minute health presentations, and I would appreciate anybody getting to me for next month. We need someone for March as well. We also would love to have any ideas for Radnor Health Matters, which is a program that's broadcast on Radnor Television. And if we could have any board member, if they would have an interest in a certain topic, or bring in someone to speak with them on television. Dr. Leader and I were just speaking before the meeting possibly about involving someone in the community to speak a bit about what are called ACOs. There's a possibility that we can get, maybe the two of us can put that program together, but any topic for Radnor Health Matters would be great. It's been quite a time since we had one produced. Dr. Capuzzi isn't here today, so we'll have to hold off on discussing any information that she's learned about the signage for male dogs in the parks who have not been neutered yet. Spayed or neutered. I can't remember, female or male. And so we can move on to some new business, and in the new business we will discuss some older business as well, which is the artificial turf information. So let's start in new business with a guest today. His name is Josh Clark. He's a Master's of Public Health candidate from Thomas Jefferson University. I thank Dr. Leader for inviting him today, and he's going to give us some information that he has on artificial turf safety. Thank you for joining us, Josh.
Yes, thank you for having me. Well, good evening, everyone. I thank you again for having me here tonight. As I was introduced, my name is Josh Clark, and I am a current MPH student at Thomas Jefferson University. Dr. Leader is one of my professors, and so I'm here tonight at her request to discuss the findings of a small literature review that we performed looking at the health risks associated with synthetic turf fields. It is my hope that the information presented here tonight will allow you to make informed decisions regarding these fields in your community. So let's start first examining the problem. Sorry, microphone. So a number of years ago, in order to begin, I'm sorry, can everyone hear me if I just don't use the microphone because I have to bend down? Sorry, thank you. Oh, okay, yes. So a number of years ago, in order to reduce costs of maintenance and increase field uses, a number of schools and municipalities began switching from grass fields to artificial turf fields. As many of you know, these fields are filled with a substance known as crumb rubber. Crumb rubber is mainly made from recycled tires. Now, these tires contain a host of hazardous chemicals, which can be divided into three main groups: semi-volatile organic compounds, volatile organic compounds, and polycyclic aromatic hydrocarbons, which is those abbreviations there. They can also contain a number of metals, the biggest ones being lead, zinc, chromium. Another hazard that has been identified in these fields is the paint used to color the fibers is often a lead chromate-based paint, which can break down and deteriorate over time, as I will discuss in a couple of minutes. The main routes of exposure to users of these fields consist mostly of dermal absorption through sweat in the skin, through the respiratory pathway, and also accidental ingestion through the digestive system. So the problem becomes are these exposures at a high enough level to classify them as a human health risk? So to answer this question, we conducted a small literature review. We searched a number of databases, the biggest ones being PubMed, Scopus, Cochrane Review, and Google Scholar. The number of articles we found currently in this field are lacking a bit, so in order to accommodate for this, we expanded our exclusion criteria to include any articles published before 2008, and from this we selected 7 articles that we feel cover a range of topics in this field. And here's what we found. So beginning first with semi-volatile organic, volatile organic, and polycyclic aromatic hydrocarbons, we found that in the literature they pose minimal risk when coming from synthetic turf fields. I have a number of studies highlighted here. I'll just run through briefly. Pavlonis in 2014 took a number of samples. They took crumb rubber samples and turf fibers direct from the manufacturing line, as well as sampling 7 artificial turf fields in New Jersey. They dissolved these samples into 3 different artificial biofluids, which are designed to mimic the environment of sweat from the skin, the fluids in the respiratory tract, and the digestive tract as well. They focused their search on 16 different compounds, the largest, which they felt were the largest concern for human health, and I have a table of those on the next slide I'll just show you. They found across all 3 biofluids, all samples, the level of these compounds were below the de minimis risk levels, and therefore concluded that no major risk was posed by these compounds from these samples. A separate study by Ginsberg in 2011 sampled air quality above 5 fields in Connecticut, 4 outdoor and 1 indoor. They found that the cancer and non-cancer risks in the air quality above these fields was very low. However, there was a concern on the indoor field where they found benzothiazole, which is a polycyclic aromatic hydrocarbon and a known carcinogen, was 14 times higher in the air on the indoor fields compared to the outdoor fields. They concluded that this risk is more a risk for young children whose increased ventilation rates may expose them to this chemical in a higher amount than, say, adults. So that was one thing highlighted in that study. Finally, we also looked at a literature review focusing on environmental impacts of and health risks associated with these fields, and to spare time, the results did support, were similar to the previously mentioned studies, to support that. Here is a brief table showing the compounds looked at in Pavlonis' study. As you can see, most were below level of detection in a number of studies, and you can see the limits they set for these there, and as I said, all were below risk levels for concern. However, one thing that was interesting found from Pavlonis' study is that lead was discovered in all 3 biofluids. We also, looking at a number of other studies, we found that lead was a concern across these studies as well, so this led us to examine this exposure a little further. A study published by Kim in 2012 found that as crumb rubber particle size decreases, the amount of lead exposure increases. Specifically, they used a digestive and acid extraction. They dissolved a number of crumb rubber samples in these extractions, and they found that particle size below 250 micrometers increased the bioaccessibility of lead by 2 times compared to crumb rubber particles larger than 250 micrometers. The significance of this findings is can be seen more when looking at the findings from a study done in 2010, which demonstrated that over time, these artificial turf fields can break down due to mechanical damage, UV radiation exposure, and weather exposure to the elements and such. They found that these breakdown can occur as early as 2 to 4 years after installment of the field. This breakdown produces a finite dust. When this dust has been tested, it's been found that the dust contains lead at a higher level of bioaccessibility than the crumb, rubber, or fibers alone. And therefore, they determined that this dust does pose a somewhat of a health hazard, especially for young children. As I mentioned earlier, increased ventilation rate is a concern in that age group. Also, pica behavior, another concern, as well as the demand for calcium in their developmental years, which can be replaced by lead during bone development if it's found in significant quantities in their systems. However, this risk has become slightly less in recent years. In 2008, the CDC made a recommendation to the Synthetic Turf Council recommending that they reduce the amount of lead in their products to the market. So the Synthetic Turf Council complied, and they have made a pledge to reduce the lead in fields installed after that date. The concern mainly comes from fields installed before 2008. So, based on these findings, it is my recommendation that VOC concerning volatile organic, semi-volatile organic, and polyaromatic hydrocarbons, no necessary action needed at this time, I believe, for these specific compounds, as the literature reflects minimal threat to human health coming from synthetic turf fields. However, it's important to note that if any of the fields are indoor, to make sure that these fields have adequate ventilation to prevent the buildup of any sort of chemicals in the air, which may pose a risk for children. For older fields, as in those put in place before 2008, that have frequent contact by children, as well as other at-risk groups, such as pregnant women, it's important to monitor lead exposure on these fields. If any noticeable dust can be seen accumulating on the fields, this dust can just be simply wipe tested and examined. And these numbers I have here, less than 40 micrograms per feet squared on the field for children, and a bioaccessibility of less than 300 milligrams per kilograms for adults. Those numbers are based on current EPA standards for surface lead numbers. This is what they recommend. They stay below. If it's found, the turf should be replaced, and contact from these groups should be minimized. Finally, as a general rule of thumb, to help ensure the safety of all age groups, it should be promoted to wash your hands after contact with these fields before performing any activities that may require touching of the skin, such as showering or eating. This will help remove any sort of lead that may have built up on the hands or other compounds during use. I have the articles referenced in this literature review here. I thank you again for your time, allowing me to present this information here tonight, and I will now answer any questions you may have for me. Thank you.
You mentioned the benzothiazoles. Are they in the crumb rubber or on the field turf itself?
They were found mostly in crumb rubber.
In the crumb rubber,
Yes,
okay.
the polyaromatic hydrocarbons are found mostly in the crumb rubber, not the turf fibers.
I mean, we find a lot of these beads around our house all the time, when the kids come back from the fields,
Yes.
and I guess that's then some of the concern. And any of the articles that you encountered, did they actually, or they're mostly, they look like they're mostly environmental studies on the chemicals found in the compounds? Have there been any studies done on more of the human health of these things, as far as, are there any studies out there that show higher risk of cancers or other issues in athletes who participate on these fields more than the general public? Have you heard of it?
Like a cohort study, like a retrospective. I did not come across any of those during my research. I'd be happy to look into that a little more, but I did not encounter any of those across my research in this time. But
Any additional information that you found about that, Nancy?
Well, I'll just share that I spent some time on the
Thank you.
snow day responding to your invitation. I found immediately on a Google search that Penn State has a Center for Research on Sports Surfaces, and
Yes,
they've
they
got a collection of articles, and I did a little bit of looking at that stuff, and I dipped into PubMed as well. And I found some biomedical studies, but they did not present any consistent pattern of risk for athletes playing on grass versus synthetic turf. The only exception is abrasions. Athletes on synthetic turf have more grass burn than people on grass turf, but no difference in infections of the abrasions. So there we are. That's all I saw.
I have two questions.
Consulted our facilities and environmental people at the university, and essentially, the studies that you're reporting and that Nancy looked at are consistent. But I was informed that a new study was begun just a couple of weeks ago, 2016. So again, it's an outreach to the stakeholders, and the hope is to develop exposure scenarios. However, one of the things that was suggested are the alternatives, and I don't know if you found that in your work, but the alternatives to the crumb rubber, coconut fiber, cork, rice husks, silica sand. But again, the caution was that if we were to use crumb rubber in any of these surfaces, that people expect and ask for safety data sheets that give them an analysis of exactly what the composition is and the percentages, et cetera, as you mentioned.
Mm-hmm. Yeah.
So we can.
It's a good suggestion, yes.
And I believe there was a news report that said at the end, by the end of this year, I think the EPA and the CDC, or two of the organizations, federal
Yeah, it's
government,
an
should have a
EPA
statement of
study.
some kind about the safety of the surfaces and on human health. Thank you, by the way. It's always, everything seems like whenever we have these discussions about safety of things, that it's such a balancing act. It's a balance. Is the crumb rubber surface a safer surface for injury purposes, for health? If we have herbicides and pesticides on these fields that we're, immaculately grooming to make them look so pretty and green and beautiful, are we exposing our children and everybody else to those chemicals as well? So I really feel like there's there's some information out here, but I think there's a lot of gaps in the information that we still have to fill in, and hopefully we can get some information from on the federal level soon. As far as our Board of Health making recommendations, we appreciate your input, and thank you so much for your presentation today. If we're tasked to make any kind of recommendations, just certainly have to utilize the information you gave us, and we appreciate that, Josh. Thanks for your time.
Thank you.
Can I ask a question related to our township? I mean, Josh was, first of all, I need to say that, Josh, you should not use we in that presentation. That was a very generous version of we. That was very much Josh, and I take very little credit. But you pointed out that the 2008 seems to be a defining line for safety of our fields. Do we know in our township how old those crumb rubber fields are, where we fall on that line of 2008? Is that the same question?
My question was, has the Synthetic Turf Council made a recommendation that fields prior to 2008 have lead testing done? Is that a proper course of action?
The CDC has recommended that
Okay.
that prior fields installed prior to that date, especially in contact with at-risk groups, children, pregnant women, they should be tested for lead exposure, yes.
Josh, I apologize, I missed the beginning of your presentation.
okay.
But what is the history of these being used? What year did they start being used? Was it 2008?
No, 2008 was the year that the CDC made a recommendation that lead be reduced in the fields.
Oh, okay.
I don't know the exact start date. I know it as early as 1998 that some of these fields were coming in, but I don't know an exact start date of when they've been used. But they have been in use for at least a decade, if not more.
And the other question I had relates to a point that Andrew had made about comparisons with the alternatives in grass fields where there are herbicides and pesticides and fertilizers and other chemical releases associated with them. Have there been any epidemiological studies comparing health risk in those fields versus these fields?
That's an excellent question. I didn't come across any in the review I did. They have done, there's been the main comparison studies that have been done between the two fields is mostly injury related because that's the main concern for the installation of the fields is cushioning for athletes. There may be some out there. I'm sorry, I can't extrapolate more on that, but I didn't come across any when I was reviewing those databases, but there may be some out there, and I'd be happy to look into that if that was something that would be interesting.
Just one quick question. So, these studies take a long time, and they have to be looked at, and tons of data needs to be reviewed before we know whether there's real risk or not. So the question is to board members as well as to yourself, what can we do now to mitigate a potential risk that we don't know is real, but we have cross-sectional data, not long-term cohort, well-controlled studies. But what should we do now? Should we be taking inventory of how many fields have these issues? Should we be doing testing to look at samples at every one of the fields to see if we do in fact have 250 micron sized particles? Should we be doing lead testing at any indoor facility in the Radnor Township? And then also just very practical things like we all are public health practitioners, and that is, how easy is it to wash your hands when you get off the field? Mm-hmm. Is there a sink that our 6, 7, 8-year-old Radnor travel soccer team, in which my sons have played on, are on that high school field, and then I don't remember where a sink is? And it may be as simple as installing some things when they get off the field they have to run their cleats through, or they have to take their cleats off, because as Dr. Foreman was saying, I have those little rubber pellets in our little alcove as they come in the house, and they're all over. You know, the boys just take them off and throw them wherever they are. I'm assuming mine are very similar to everyone else's, despite what my wife and I say. So potentially we have a risk that we don't know how to quantify as yet, but I don't know that my experience with the CDC and although they're wonderful organizations as well as the EPA, we may be waiting at least a week or two for that data. And so the question that we have to sort of think about is, what are we going to do until we get that information, and how can we as board members assist in a practical way to mitigate that risk longer term? And so maybe, is there another committee that looks at the fields that we could?
So the EAC has requested our information about the artificial turfs. That's the Environmental Action Committee. Is it saying it right? And yeah, I think they're excellent ideas, Ahmed. I mean, really excellent ideas. You know, would it be something that the Board of Health would make recommendations at this point to say, you know, first of all, I think we need to do a little bit of research to figure out when these fields in this township were built. Second, are there indoor facilities that have these in our township, or is it just outdoor? The maintenance of the field, you know, we don't know how often these are maintained and replaced. The rubber beads on these fields have to be replaced relatively frequently, because they do come off, and that changes the sponginess of the field and the safety for the athletes. But do we make recommendations to the AC on something to the effect of, you know, washing stations, signage that says specifically, you know, your children should wash their hands after they leave the field, or something like this? I think these would be very, very, you know, excellent recommendations to make to be ahead of the curve even in the country for these things. I'm sure there are some boards across the country, which I've read about, that have already banned these, thinking they're ahead of the curve by saying let's not approve any more of them being built if they're being used with the rubber pellets. Although one of the communities has allowed it to be used with the cork or the rice or the coconut hull beads, but have denied the other ones. So I think this is a great idea of discussion, and maybe something that we can even make a formal recommendation to the AC by March or April's meeting. So I think it involves more discussion and more research on our part, and I think we should, you know, continue on this path. Thank you. I appreciate it.
Thank you.
All right. Cool. All right. We'll move on to some more new business very quickly here. Where am I here? Okay. So we haven't discussed it too much, and it might be a nice subject for Radnor Health Matters or just for a presentation here at some point, but there is really a health epidemic in this country with opioid use and overuse. And it's something that I think that gets overlooked because it's a medication that's prescribed by physicians, and it has its right use. They are excellent medications for people who are recovering from injury and from surgery. However, the problem with these opioids are that they are extraordinarily powerful. They are very valuable in the black market. They are overused in many cases very legally by getting excess prescriptions from physicians, sometimes appropriate and sometimes not so much. But it is a real public health epidemic that we are going to see more and more and more people suffering from either overdosing or the other consequences of opioid use, which include moving on to street drugs, heroin, and other things that contain these opioids. An interesting thing that our state has done, Governor Wolf signed a bill, I think it's number, here somewhere, Act 139, which allows the use of naloxone, which is a Narcan, which is a blocker of opioid receptors, which immediately brings someone who has had an overdose of an opioid out of that overdose very quickly. There's a number of ways to administer it. There is a nasal spray now. It can be used in the field by any health provider. It can be used by firefighters and EMS. Act 139 allows firefighters, EMS, and other organizations who are first-line providers for health to use the product, and also protects them similarly to the Good Samaritan laws that exist with CPR and other ways that we help people in the field. There are risks to Narcan because it can cause a change in blood pressure and heart rate. It can also, improperly used, it shouldn't be improperly used in people who don't have an opioid overdose, but it is a life-saving medication and should be available to be used with an observation of someone who is suffering from an opioid overdose. And Act 139 provides healthcare providers and anybody else with the protection that they deserve to save someone's life. So in the future, hopefully we'll discuss a little bit more about the epidemic of opioid overdoses, but I think that Act 139 is a nice, a helpful thing for our state and something that we should all know about. Give everybody a brief update on the Zika virus. I think another issue that's been on the news a lot that I think is on the headline of a paper almost every day. But just real quickly to let everybody know what it is. The Zika virus is a virus that's transmitted by mosquitoes, specifically the Egyptian mosquito, which is a difficult mosquito to control because it is a daytime biter. It also is the same mosquito that transmits the dengue and the chikungunya virus. So all of these viruses are difficult to stop because the Egyptian mosquito is extremely difficult to eradicate, and it's not an easy one just to put your mosquito netting on at nighttime and protect yourself like you can do for malaria, which is more of a nighttime biting mosquito. The virus itself is a mild illness in many people, and I think it's 7 out of 10, there's hardly any notice that there's any illness at all. The symptoms would include fever, rash, joint pain, and red eyes for about 3 to 7 days. The issue, of course, with this virus that we've heard about in the news is that the virus itself, if it's infecting a pregnant woman, can affect the fetus and cause some very serious and sometimes life-threatening defects in the fetus. The major one being microcephaly or anencephaly, which would be the absence or a small brain. In U.S. citizens, there have been 52 confirmed cases, all of them in travel to the Caribbean or other at-risk countries, including South America and Central America. There have been 2 cases of citizens getting it traveling in Pennsylvania. Now, the numbers are probably much higher than this because everyone isn't tested. They're only tested if they have symptoms or if they were pregnant and in the islands and they were tested for it then. So the numbers are probably much higher. There has only been 1 confirmed case in the United States, transmitted in the United States, and that was actually by a sexually transmitted case in Texas from a traveler who was infected who gave it to a partner. The U.S. territories that have had cases include Puerto Rico and the Virgin Islands, but no continental United States has there been a mosquito-borne transmission of the Zika virus. There is no vaccine or treatment for the disease. There is nothing that can be done once it's acquired. Pregnant travelers with symptoms are supposed to be tested as soon as possible with a PCR test, which is a very specific test for the virus. And any traveler who is asymptomatic who is pregnant should be tested both 2 and 12 weeks post-travel for signs that they also have the viral particles in their bloodstream with the PCR test. And again, then decisions can be made on how much testing should be done on the baby for genetic abnormalities. And the interesting thing that I read was that even some of the cases of this transmission to the infants had normal ultrasounds at about 17 to 20 weeks, and then later on had some very tragic results. So it is important to follow these testing parameters according to CDC. That's the big things. So again, it's prevention is the key, trying our best to use, if we're traveling to these higher risk areas, to use DEET, which is a approved medication for anybody over 2 months of age, to prevent mosquito stinging. There is no evidence to show that some of the natural alternatives are as good as DEET and the other, some of the other chemicals that do prevent mosquito bites. Also, clothing and using, I think it's permethrin-infused clothing can also repel mosquitoes as well. So a little bit of information about Zika. We hear about it every day. I think, again, this is going to be something that we hear a lot more about as this, as we get toward the spring and the summer and the mosquitoes make their way up the coast of the U.S. And I think we'll probably see some mosquito-transmitted cases in the south this spring or summer. To update everybody on influenza activity, it's still not too late to get your flu vaccine, although we're getting close. We're getting toward the middle to the end. Delaware County has reported 106 cases of flu. It has been a later season this year. However, it's going to probably be similar to last year in the numbers according to the CDC. Montgomery County saw 169 confirmed cases. And again, as I said last year, these numbers are always very small. People who are getting tested are the ones that seek medical help, and there are many people who probably have the flu and go to their doctor and don't ever get tested, so it never gets reported to the boards of health. Let's see. Okay, so the big things for flu would be if you're having the symptoms of flu, which is usually a quick onset of a high fever, coughing, muscle pains and aches, and stuffy nose and things like this, that you seek medical attention. There is only one way to treat the flu effectively, and that's with a medication called Tamiflu, which will shorten the duration of the flu, however, not destroy it like we have the luxury of having antibiotics that help with bacterial illnesses. But Tamiflu can shorten the course, and has been shown in some studies that it can save some lives in the elderly and the young who get infected with the flu. So seeking help and also getting vaccinated would be the two major things. Does anyone have any announcements or any other new business before I leave new business? Anybody else? Joan? Yeah. Oh, sure. Yeah, if Joan could, thank you for coming today. But you can update us a bit on a bit about the unneutered male dogs in parks.
So basically, there's very good public awareness already of the importance of spaying and neutering dogs. 83% of dogs in the U.S. are spayed or neutered, according to the ASPCA. And so this issue really doesn't affect that many owners and dogs. The issue of whether they will be required to, if they're going to be bringing their dogs to Harford Park, which is a leash-free dog park, whether they have to be neutered. I think it's a big issue. Studies show that it's a big issue in terms of inner dog aggression, dog fights. Testosterone is responsible for, I don't want to say aggressive tendencies, more reactive tendencies that result in inner dog aggression. And testosterone titers start to rise in puppies at 4 to 5 months of age, and then sexual maturity in male dogs is 6 to 9 months of age. Intact, sexually mature males exhibit associated testosterone behaviors. They show a lower trigger point for reacting. They react really fast. There's a huge difference. I see it, out and about, and I see it in the office. Like the minute I open the door, I can tell without seeing if a dog has already been, if a male has already been neutered, because of how quick they are to react, just their sort of general jumpiness. It's not aggression, it's just sort of a jumpiness. They're more rapid to react, their reactions are more intense, and they're of longer duration. They also exhibit roaming behaviors, which certainly are an issue if somebody's taking their dog to a leash-free dog park. They're more likely to be the rogue dog that just kind of takes off. Sexual behaviors, including mounting, and that mounting applies to of other male dogs, of females, and also people. If anybody has ever had that, getting your leg humped by a male dog. Urine spraying, aggression towards other dogs, primarily other intact males, and especially in the presence of a bitch in heat. So male dogs have been found to be 6 times more likely to bite than, this is a typo, than female dogs. It's supposed to say female. Intact dogs are 2.6 times more likely to bite than neuter dogs. So castration is shown to reduce several types of aggression. One is intermale aggression amongst males in 60% of cases. Household aggression, so in the house aggression towards other dogs in the house and also towards the people in the house. Territorial aggression towards dogs that they're not familiar with, that are near their house or near a place that they consider to be their territory, and then also dominance aggression. And of course, there are other benefits to castration which don't apply to safety at dog parks. So there are medical benefits, testicular cancer, prostate disease, different types of tumors, UTIs, and then of course population control. So, it is a risk if somebody brings a male dog that's intact to one of these leash-free parks, and there are bitches in heat. It doesn't take much to impregnate a female dog, and it's very hard to separate them once they start mating. Now, some of the opponents of neutering and spaying, first of all, they might want to have a litter in the future, and we do know there is a huge, huge dog overpopulation issue. But I think there are issues of personal preference. I think some people are just not comfortable with the idea for their own reasons. And then I think another big issue, or another, very minor issue, because most people are not aware of this, there are certain potential linkages, and there are studies being done on associations between certain types of cancers, lymphomas, that are of a higher rate in spayed and neutered dogs. So that's out there. The minority of people who keep their dogs intact are aware of this issue. And it might not even be an issue. It's speculative. So as far as, should we be talking about neutering male dogs, and should we be also talking about requiring that females be spayed for the purposes of safety at dog parks? No. Actually, spaying has actually shown to increase aggressive behaviors in bitches that have already shown aggressive tendencies prior to spaying, because progestins have sort of a sedating, calming effect. So no, as far as that goes. Again, most aggressive inter-dog interactions concern males, not females. I think we talked briefly about, there were some questions about enforcement if the township does decide to go ahead with something like this. There are many parks in the United States, in my research, that do have these regulations, and usually it seems like it's just kind of something that's enforced by signage. And to put it in the hands of the dog park board, which is not responsible for enforcing rules or safety, nor should they be, because it's certainly a safety issue for them and they shouldn't have to police that. Really, making people aware, posting signage, and if they choose to follow it, great. If they don't, somebody can tap them on the shoulder and say, hey, this is the rule. And if they choose to get, call the police and say, hey, they're not following the rule, they should put their dog on the leash if they're going to have them here. And of course, neuter dogs should be able to go to the park, should be able to go anywhere, but they really should be on leashes. And as far as timing to neuter, again, testosterone levels start to rise around 4 or 5 months of age. Neutering for the purposes of anesthesia is safest after 6 months of age. So I would say, puppies, of course, should be socialized and allowed to go to leash-free parks, whether they're neutered or not. But by 6 months of age, people should really get their dog to the vet to get neutered, because I think it really does create an unsafe situation. And what else? Any questions?
Really appreciate all the research. That's really excellent. And again, it's something that as the board we can do is to make a recommendation for signage and for, for the safety of people to read, to have information about what to look for. And it seems to me that, if people understood that this is a risk because of signage and things like that, they may be more apt to, keep their dogs close and try to, if there is a dog that's a little bit more, looks like they're being more aggressive or whatnot, just to be safer with their dog.
And it's really not, I don't want to be misleading, or I don't want this to be misunderstood. It's not an aggression issue. I can't say that, and there is higher inter-male aggression and inter-dog aggression, but they're not aggressive per se. It's more they're reactive, and then what happens, the other dogs get scared because these dogs are kind of too jumpy and too, and then a fight results. It's not necessarily that, people get very offended if you say, oh, your dog is aggressive because the dog is not neutered. That's not the situation. It's really, they result in fights. And the issue is the result. And if they're more likely to precipitate and be involved in a fight, then the best result is that they be controlled by being on a leash or be neutered, not necessarily saying that they are per se aggressive.
Is there, you mentioned precedent in terms of signage at other parks.
Yes.
Could you talk a little bit more about, where that's in and the effectiveness of that in terms of reduction of these encounters and fights, et cetera?
You know what? I don't know that there are tabulations as far as, decreases, and I did look into that. I couldn't find any clear-cut information on, at this park in Minnesota, dog fights have gone down X percent since we started enforcing this rule. But I'll look more into that. And I've actually put out some feelers to answer that very question. But there are a number of parks in the country that require this. So this isn't something that it's not new, it's not a foreign concept. I think people generally recognize it, the value of it.
It seems like the animal issues, though, do sometimes get the most public participation and public concern. So we definitely want to, take that into consideration. And if the public has any input on this, we certainly welcome their input. We're here next month on Monday, March 21st at 5:30 p.m. So back to our Monday schedule, and we're always welcome to have the public come in and share their opinions on any of the matters that we speak of. One announcement that I have, thank you, by the way, Dr. Capuzzi, for that information, that there is the Villanova ongoing series, the Health and Human Values Lecture Series, a lecture that I will be hopefully attending in March 10th at 5:30 p.m., Thursday night, and it's a lecture about vaccinations. So it's From Market to Misinformation, Addressing the Science and Facts of Vaccines, definitely a topic that I have a lot of interest in, and I hope to attend that. So any other announcements anyone else has? No. I did contact another one of our board members, Marion McCarthy, via email this week. I'd like to get the board more involved this year to plan for next year's Teen Health Week, so we can actually do a lot more than I felt that we could do this year with a month and a half kind of notice before at least announcement at our meeting. I'm sure they had plenty more time to plan that awesome week, but we can certainly be of more assistance and hopefully get the schools involved as well. I would love to be involved in Teen Health Week for 2016 or 17.
17.
17, yeah.
Next year.
17.
Just to give a quick little shout out to our 2 student interns who took this matter with Ms. McCarthy's help to the principals and both the high school and the middle school and possibly even the elementary schools. I'm not sure. You were doing really good work over there with Ms. McCarthy. So do you want to maybe give us any updates that or things that might have happened in school that week?
So I emailed both the middle school principal and the high school principal, and I'm not really sure what ended up happening at the middle school because I never emailed her back after that. But I mean, at the high school, we tried to promote like a Spirit Week on the announcements, but I don't think that worked very well. So I think it was just difficult this year since it was like our first year doing it and having it be like midterms week and everything, but yeah, we try to spread the word, so.
That's great. We really appreciate your energy and help in doing that. Thank you.
Yeah, and thank you also for the minutes the last few weeks, a few meetings. We appreciate it. Seeing there's no more announcements and no public participation, I thank Josh for coming in today to give us our presentation, and we will adjourn for this week, and we'll see everyone on March 21st, 2016 March 21st, 2016 to 5:30 p.m., right? Monday. Thank you.